Welcome, listeners, ladies and gentlemen. You are tuned in to the worldwide launch of Eagle Radio International. I'm Ace Ramirez, and you're listening to this segment dubbed Let's Pick Your Brain. In our first episode today, let's start with the discussion in geriatrics. When we talk about geriatrics, we usually equate it with older people. So, what are the medical issues affecting the elderly? Joining us today through Google Hangout is a geriatric specialist, Dr. Minerva Navarro, all the way from Palo Alto, California. Hello, Dr. Navarro. Thank you for joining us
Hi.
today. How are you today?
Hi, glad to be here.
Thank you for joining us. And if you don't mind, we'll pick your brain.
That's why I'm here.
Okay, so let's start. Can you tell us more? Maybe a lot of our listeners don't have any idea, or maybe a small idea of what geriatrics really is. Can you tell us more about it?
What geriatrics is?
That's right.
So geriatrics is a branch of medicine that specializes in the care of the elderly. As you know, when we start aging, our body ages too, and there are many changes that make our health different from a younger person.
I see. Well, what made you go into this specialization?
Field?
This field?
Yeah, so I started out doing family medicine residency, and you cannot go to geriatrics unless you are internal medicine or family medicine. So while I was doing my family medicine residency, we did have a geriatrics rotation, and it was a very fulfilling rotation for me, caring for the elderly. They are very appreciative, and I just find that difference in how these people age and how they live in their golden years.
Right, a very noble cause. How long have you been doing this?
Around 10 years. Oh my gosh.
10
Almost
years.
10
Wow.
years now.
Oh, so that makes you 25 now.
How I wish.
Well, so let's get into the meatier part of our discussion. What's a good age, or do we base it on age? When do we start seeing a geriatrician?
So geriatrics hasn't really made into the same kind of care as pediatrics. So when you talk about pediatrics, it is the care of the children up to the age of 18, sometimes 21. But geriatrics is not based on age like that. We haven't really gotten into a point that all persons above the age of 65 actually need a geriatric specialist, because people age very differently. So there is, for example, a 65-year-old old lady who is actively doing marathon, biking, and swimming. And there can be a 65-year-old lady who's pretty much wheelchair bound from a lot of chronic medical conditions, recurrently falling. So tapping more on based on how a person ages and what are her or his conditions at a certain age. So it hasn't really been an age cutoff. It is more like how a person is around 70 or 80 years old, and how many health problems they have that they require a geriatric specialist.
I see. See, so even if you're younger than 65, you can see a geriatrician.
You can, but normally, 65 is a usual senior cutoff. What I'm trying to say is, even if, for example, you're 70 or 75 years old, you don't really need to see a geriatric specialist if you are very active, don't really have much age-related complication problems, your regular primary care provider, like a family medicine doctor or an internist, have some age-related complications in your health that cater more towards geriatric specialists.
Right. So you mentioned what age-related illnesses or diseases. Can you tell us more about what are the common illnesses or diseases affecting the elderly today?
So the elderly that I'm going to describe here are going to be the older elderly. So when you talk about seniors, there is the young senior and the older senior. So it's not all just because you're senior, you know, an 80-year-old senior is the same as a 65-year-old senior. So the diseases that I'm going to talk about here are more related to the older seniors. So the common ones that affect them include like a memory loss, depression, as related to social isolation, recurrent falls, Parkinson's disease, stroke, incontinence, and just progressive decline as a result of advanced age.
Mm-hmm. So it's a wide range of health problems for the elderlies. For our discussion today, let's focus on say memory loss. Uh, what's your name again, doctor? Is this
Minerva Navarro?
No, I was just playing. But is this part of memories? Like at my age, if I forget someone's name, can we consider that as a memory loss?
Not really. There are signs of memory loss that we may consider as red flags versus the usual, you know, I can't remember somebody's name, especially someone that I just met. Like the two of us, we just met today. So that is not considered a pathologic memory loss. So there is such a thing called, you know, like a pathologic memory loss that we consider that needs more special attention than the usual, you know, forgetfulness. I forget this and forget that because I'm busy, or even part of an age-related memory loss.
Mm-hmm. So what are the early indications of memory loss? What are the telltale signs?
So that is that needs special attention includes those that have started disrupting a patient's life, you know, their daily routine. So a memory loss, like for example, losing your keys. You know, people lose keys all the time. If you lose your keys and able to trace back where they were by being able to trace back your steps, that is not a pathologic memory loss. But if, for example, you lose something and you keep losing the same thing, but you can't find them throughout the day, or you call your daughter or your son, and then your son finds your keys in the oven where it should not be. So that seems to be a pathologic memory loss. So other things that is pathologic is like not being able to remember family members, because there should be an established kind of memory in your brain about your family, about your day-to-day routine. And if you're not able to retrieve that, that is pathologic.
How about my grandmother who keeps on calling me a different name, sometimes a girl's name, actually? Is that considered the pathological memory loss?
Yes, that is actually considered a disturbing kind of memory loss, because I would think that your grandmother knows you from years and years, and she should be able to decipher a male and a female name of family members. So unfortunately, I have to tell you that is not a normal memory loss related to aging.
That's sad. I had this. I used to live in. Well, I went to a dorm, and my landlady would go out, walk around, roam around, and just lose her way. She cannot remember how to get home, but she would remember the phone number at the house, and she would call, "Can you pick me up from this and that? I just don't know how to get home." What do you call that? What do you consider that as?
So, you know, with all this memory loss comes any kind of memory loss that disrupts a usual day-to-day routine, like that going home is considered abnormal, because it disrupts, you know, the day-to-day routine. So if you're going home and you can't trace back how to go home, even if you remember certain numbers, that is still considered a red flag. So when we talk about memory loss, so a common diagnosis that pops up is dementia. You know, and dementia is a broader name that speaks of pathologic memory loss, but it doesn't only affect memory loss. It doesn't only affect memory, but it also affects the other function of the brain later on. For example, orientation, judgment, abstract thinking, language.
Right.
So, and all of these in the brain function affect the way a person live day to day. So that is the pathologic kind of memory loss. It also involves other functions of the brain.
It sounds like a more dangerous kind of memory loss. Dementia versus Alzheimer's. What can you say about that?
So, okay, so Alzheimer's is actually a type of dementia, and it is the most common type of dementia. It comprises 60 to 70% of the dementia that we see in the population. Causes of dementia other than Alzheimer's disease, but Alzheimer's disease is the most common one.
Alzheimer's is what Muhammad Ali has, right?
Yeah, Muhammad Ali has Alzheimer's dementia, and I'm not very familiar with his case, but I know that he had a lot of concussion.
Right.
Part of his boxing career,
Right.
And concussion head injury is actually a risk factor for developing Alzheimer's later on in your life.
I see. I've read some articles relating Alzheimer's with hard blows on the head or concussions. Well, we're going to go on break, and when we come back, we'll talk about the dangers of memory loss and how to help the people we know, our loved ones especially, how to help them if they are suffering from memory loss. You are listening to Let's Pick Your Brain, produced by Eagle Radio International. I'm Ace Ramirez, broadcasting from Washington, D.C.